Hello, everyone. It's Monday, July the 27th, and we always start off with an update of whether or not we've lost anyone in West Virginia. I was really hopeful, and through the weekend it looked pretty good, but with the reports coming in, from late yesterday, early this morning, we lost 3 additional West Virginians. They're the 104th, 5th, and 6th death in West Virginia. We lost a 60-year-old female in Wyoming County, an 84-year-old female in Mineral County, and a 93-year-old female in Brooke County. I feel like I'm a broken record, and I don't want to be that. I want you to always know just how important that these people are and have been, and what an incredible contribution that they made to West Virginia, and they're great West Virginians that we've lost with this killer virus. I don't want them to become a number. I don't want them to become 104, 105, 106, because they've got names and they've got families and they've got loved ones, and absolutely they've got wisdom that we will miss in so many ways. So please keep them in your prayers. Our prayers have been heard in West Virginia over and over and over. I truly believe that the Lord above is looking out after us. And I believe, just from the standpoint of the miracle that has already happened. So please continue to keep all these people in your prayers, and in some way, somehow, we're going to get through this. As far as our numbers, yesterday we had 96 new positive cases out of 3,990 tests, for a daily rate of 2.43. That sounds pretty decent. Now just think about this. In West Virginia, we have now active cases of 1,703. It's a record for West Virginia today. It continues to climb. It'll continue to be a record until absolutely we get this thing really trending the other way. During the weekend, we had a total of 223 additional positives. Like I said, 96 yesterday. Kanawha County has 266 active cases now and is the highest in the state. We have had extensive discussions, with the docs and everybody in Kanawha County. They assure me that they've got this under control, and they feel like that this is totally community spread. It's not driven from the bars, but they feel very confident that they've got this under control, and I entrust them, and I believe, that we're going to get through this in Kanawha County. In Mon County, we now have 177 active cases. I think we dropped down to like 143 or some number close to that, and we bounced back a little teeny bit, but not much. Remember, we had 394 active cases at one time, absolutely significantly ar-driven. And with kids, coming back to school and all that, and kind of piled on top of one another in a bar setting. From a standpoint of the national level, numbers are still really good in West Virginia. You continue to be the miracle that everyone talks about, and we have fewer total cases and fewer deaths and all those great things and everything. We just want it to stay that way, and only thing that I keep telling you is just this, and only this, and that is West Virginia. You are the oldest state. You are the most chronically ill state. You have the most lung problems of any state. You are sitting right with all the border states all the way around you. You are sitting within a rock's throw of 2/3 of the population of the whole country. You could explode in the most negative way that you could ever fathom. And absolutely, West Virginia, you've got to continue to do all the things that we're telling you. I know the inconvenience of wearing a mask, but West Virginia, that is absolutely essential today. And absolutely, I know how different it is to have to wash our hands and keep our social distancing. And absolutely, I know how life has changed, but West Virginia, it's so much easier. You know, I heard this person say, you know, for those of you that don't like wearing a mask, just think how uncomfortable it would be wearing a ventilator. And so you got to watch, West Virginia. Please watch. Now, I've got some good news here today and everything. I've got a fellow with me that I love teetotally to death. He does a phenomenal job as our curator, Randall Reed-Smith. And Randall is going to talk to you just a little bit about the arts and about our fairs and festivals that I feel absolutely essential to us in every way. And I want to try to step out and help just a little bit. But if Randall could lead off, and then I'll tell you a little bit more about it.
Hi, Governor. Thank you. We're in our second year, as you know, as the Department of Arts, Culture, and History that you created to keep the arts going strong. And because of that, we continue to get much more national recognition. And you've always been committed to the arts, especially heritage and cultural arts. And that is not seen anywhere greater than our fairs and festivals. Fairs and festivals, our heritage, economic development for some of our smaller counties. And we're very happy today to hear of your support to keep our fairs and festivals going, because fairs and festivals, that's essential for our development of our communities. And we are very appreciative of your constant support for all the arts and our history in West Virginia. Thank you, Governor.
Thank you, Randall. Thank you, sir. Let me tell you this. Randall is a guy that's stuck on. He's a guy that has so much talent, it's unbelievable, and he gives so much back to kids and so many different areas that Randall gives. But he is our curator and doing one whale of a job. And, you know, and it is essential that we preserve our arts and expand our arts, because that's who we are. That's absolutely who we are. And I could never say enough. I mean, really and truly, we've got a lot of great people and doing a lot of good work. But you know, Randall Reed-Smith is one of our superstars, and I just wanted to keep on doing it. Now, let me talk to you just a second about fairs and festivals. You know, and this is driven primarily just from this. You know, in the beginning, we had to say we can't have our fairs and festivals. Then we felt like maybe we could have them, and we said we're okay. Looks like we're going to be able to have them. And then we had to turn around and say, no, we can't have them, because we know just how fluid this whole situation is. So I've been trying to figure out, and, you know, and it's taken a little while to figure out what's what and everything else, but the long and the short of it is our fairs and festivals were sent $1,346,000. There's 400, right at 400 of them. I think it's 392. And they're all across the state, and in each and every county and everything. And then there's even been, you know, some level of request, you know, from the standpoint of, if you didn't have the fair and festival, maybe what you should do is send the money back and everything. And that's not in my hands. That's from the legislature standpoint and everything. And they're trying to do everything from the prudent side and everything. But from my side, you know, I just want to just do this. I have enough dollars in our governor's contingency fund that I'm able to do with pretty much what I want to do with. And so what I'm going to do today, and it'll be going out just as fast as we can get it out, and government doesn't move all that fast, but what I'm going to do is double up. Basically just this, that if you're a fair and festival in West Virginia, because I have been advised by the leaders of the people that are the Fairs and Festivals organization, that just this, that because of this terrible COVID situation, and because of lack of funds, and because of planning costs, or maybe down payments, or whatever it may be, our fairs and festivals, we stand to lose 50% of our fairs and festivals that'll just go under. Well, we can't have that happen. I mean, that's all there is to it. We just plain can't have that happen. And so maybe this won't save them all, but I hope to goodness that it'll save a bunch, and I hope really it will save them all. But what I'm going to do is I'm going to take the, where before, and I want to be really sure that everyone understands, the $1,346,000 that you got for all the fairs and festivals from the legislature, that I'm not talking about in any way today. I'm not talking about that in any way. I'm not talking about the monies that you'll get for the up and coming year in any way. So there's three pots. There's a pot that was a pot that you've already gotten, and maybe you've received a letter to send money back, and that is for you and the legislature to figure out. From the standpoint of future, absolutely, I hope and pray that we'll support our fairs and festivals in every way, and I feel very, very confident that the legislature will do so, and all that will be great. From the standpoint of the third pot, which is right here that I control, what I'm going to do is I'm going to go to each one of the fairs and festivals, not physically, but I am saying each one of the fairs and festivals is going to receive from the governor's contingency fund that's your money. We're going to pay it out immediately. The $1,346,000 is going to go to all 392 fairs and festivals in an effort to just kind of backstop and ensure that we will continue to be able to have our fairs and festivals, because I think, that's the backbone of our counties in lots of different ways. We have a lot of backbones, but this is one, and so I'm tickled to death to do it, and it's driven by the fact that I've sat here and told you you're on, or you're off, you're on, you're on, and then back off, and so maybe this will help a little bit, and so that'll be going out real soon, and it's going out to, I think, 392 total across our state. In each and every county there'll be recipients, so that's just good money to spend, and that's the stuff that I think we got to do. Now, if I could go through some more announcements, and I'll go through them as quickly as I possibly can. In the churches, we have outbreaks today in our churches that are reported in 8 counties. We have, those counties are Mason, Boone, Grant, Logan, Kanawha, Raleigh, Taylor, and Wood counties. Total of 137 people that are involved. Again, I tell you over and over and over, please listen to me. Wear a mask, social distance, stay a pew apart. It is probably maybe it's not number one. It is a spot that can spread this thing and spread it especially to the elderly, and that is exactly where we don't want it to go. Be careful. Stay on your game there, West Virginia. As far as our small business grants, all that's continuing to move, and it's moving very quickly, and I can't thank Ann Erling and all the people that are working that, from the auditor's office, J.B. McCuskey, and everybody. They're moving it, and they're moving it just as quickly as they possibly can. It is right now for people that have 1 to 35 employees, but we're trying like crazy to find ways that, entrepreneurs that don't pay themselves as an employee, that we'll be able to qualify those people. But that's a heavy lift, and we're trying to get there, and we're trying to make sure that, insurers against fraud and lots of different things. But we're trying, we're working it. As far as our free testing, this week we're in Gilmer and Marion counties. Next week we'll be in Hampshire County, and we continue to urge people to go out and get tested. It doesn't cost you a dime. It doesn't hurt. It doesn't take any time. Really and truly, the more we know, the better we'll be, and I say it over and over. As far as our grants to our cities and counties, we're up now to $57.5 million. 160 cities and counties have applied. We continue to ask people to continue to apply. The more monies we can pump out, legitimately following all the guidelines and everything to our cities and counties, the better off we'll be. This is the total that's been awarded so far. The more we can get into our cities and counties, that means federal dollars. That means the more things that those multiplier dollars work for, the better off we'll be. As far as our summer feeding, we want to absolutely make sure that no West Virginian goes hungry in West Virginia. There's 696 sites If you got a problem, call 211. It's right there on my website and everything. Call us. We'll help you. Now, I remind you about our census. That's really, really, really important. We got to get counted, West Virginia. We're going to leave money on the table, and this is big, big, big money we're talking about here. I also remind you just this, watch the TV. There's going to be another stimulus package on the way. I urge our legislatures, we've had a meeting, with our task force or our advisory force or whatever you'd call it and everything. We just had another one and everything where I'm urging the legislatures to go through these grants, go through them like crazy and find where your constituents will fit into these grant programs and everything. There is $1 billion, and I said with a B, $1,147 million that are in these grants for all kinds of different things that can absolutely, we do not want to leave money on the table in West Virginia. We can't do that. Now we got our highway department cranking, we've got our small businesses cranking, we've got lots and lots and lots of different things going on right now. But those grants are absolutely where we could end up leaving money on the table. And I would tell you, West Virginia, that probably within the next 10 days or less, there's going to be a fourth stimulus package passed. There'll be more dollars flowing to our individuals that are hurting still on unemployment. There'll be more dollars flow to us from the standpoint of potential PPP applications. There'll be more dollars flow into this state that we can do stuff with and everything. So watch the additional stimulus package, but please get to your legislatures and get into that grant program and see where we can qualify more and more West Virginians to be able to take advantage of that. Now, we've got 20 people that have been tested positive in a Princeton nursing home. Absolutely, the National Guard, under my order, is running to the fire. They're going to test everyone there, and we're going to try in every way we possibly can to suppress this situation and suppress it immediately. One only other thing I've got I've got two things real quick, but the only other thing is we had a political hoopla go on in the town of Gary. Well, really and truly, when our people found out about this situation, and Gary was out of water in our office and everything, what we did is we immediately contacted the National Guard, Homeland Security, and everything, and they immediately took a water buffalo truck or whatever down there, and that went immediate, and so we're trying in every way to help those people in the town of Gary and everything. Great people. I'm through there from time to time, and we absolutely want to help them. And if you're in Gary and everything, and we haven't helped and everything, we just holler and we'll come. We'll keep pouring it on until we make sure everything's in good shape there. Last thing, good thing, fishing license of all things. Last week I reported to you that the West Virginia State Park saw a 227% increase of online reservations from West Virginia residents. It's great. It's phenomenal and everything because West Virginians are utilizing the resource that they already have. Today, I want to announce this, that for June 2020 compared to June of 2019, our hunting and fishing license sales grew by over 40% in the state of West Virginia. In June 2020, the DNR sold 43,091 licenses compared to 31,000 the year before. And our fishing sales, and this really is interesting, we declared, we went like 60 days and we gave free fishing license to everyone. But basically, we let people fish for free. Now get this, over 50% of all of our fishing license sales for this year have been from new first-time license holders. Now, what does that tell you? Here's exactly what it tells you. It tells you that when we did the program to let people go fishing for free, a lot of people went. A lot of people that had never probably ever been fishing before. And they went and they had a great time, and now they're buying license to go forward. You know, it was a great program and everything. It's what we should have done, and I'm just tickled to death, you know, that people are getting out and enjoying the great outdoors of this state, because it is absolutely magnificent in every way. Go fishing, go hunting, go walking, go hiking, go biking. Absolutely, this state abounds in beauty like you just can't fathom. It is absolutely just terrific in every way. And the last thing I want to say on this is that discount, that 30% discount, you know, to all West Virginians is still in effect, and it goes through August 31st. So continue to use it and enjoy yourself. And last thing I'm going to report is just this. I always go to our graphs real quick, and and you'll see just this, and I don't want to end on a not very good note, but you see our two lines up at the top are not widening like we would like them to widen. They're still okay, but they're not as good as they need to be. You'll see our daily positive is trending a little bit down, but it's still above that dotted line, and we'd love for it to be below that dotted line. And down below, you see our cumulative positive number. Now our cumulative positive is 2.28. You know, that's probably the highest that it's been since the middle or the 10th of May. And so we don't like that, and we got to do better. You know, I heard today that, and I don't want to misquote, but I believe in Florida, it may have been somewhere else, but I think it was Florida, that bottom number, which we're saying is 2.28, in Florida was 18%. So we're nowhere close to being a Florida, but not long ago, Florida was tracking really, really closely to us. And so West Virginia, just stay the course. You know, there's all kinds of stuff that's happening in regard to the vaccines and drugs and everything. Just hang in there, West Virginia. I mean, for crying out loud, you don't want a tragedy in your family with any of your loved ones and everything. And if we can prevent it, and I think we can in lots of ways, if we'll just hang in there for just a little bit longer and everything, I think we're going to be okay. You know, but we got to do that. So anyway, God bless you, West Virginia, and thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. As the governor has communicated, we are seeing a somewhat reduction in our reproductive score, but we're still over 1. Today we're at 1.05 on the rt.live website, and that has been a downward trend over the last 4 or 5 days, but we still know that anything over 1 means the virus is still spreading, and anything under 1 means the virus is not. 2, I think, important and very interesting things have come out in the news and also in the medical literature in the last few days. One is that there is a study that followed people who presented to an outpatient clinic with COVID-19. And these are people that weren't sick enough to go into the hospital. And what this study found was that 2 to 3 weeks after their infection was done, 35% of people still had lingering symptoms. They didn't feel normal. And importantly, when they looked at the 18 to 34-year-old group, that 1 in 5 people at about 2 weeks had not been able to return to work because of the symptoms they were having. So this information, along with other reports that are starting to be coalesced, would suggest that COVID-19, you know, if it doesn't cause you to go into the hospital and doesn't cause you to go on a ventilator, doesn't mean it's not a substantial issue, and that we know now that people in the outpatient setting about a third or perhaps even a little bit more of those people will still be affected. And young people with no other predisposing health problems, about 20% of people have prolonged symptoms. Important. The other one, which I think is really important, and the governor mentioned Florida, but there's a report out of Florida looking at a time frame from July 16th to July 24th. They looked at the number of children 17 and under that were diagnosed with COVID. That's an 8-day time span. And the number of children went from 23,170 on July 16th to 31,150 on July 24th, which is a 34% increase in spread. Importantly, during that same time frame, they found that on July 16th, 246 children 17 and under were hospitalized for COVID-19 in Florida, and by July 24th, 303 children were hospitalized, which is a 23% increase. So not to say that to scare people, because we know that children are generally less able to catch COVID, particularly the 0 to 9-year-olds, and less likely to spread it. But it says to us that we need to be really careful, and we need to be careful with young people as well. And I hope that our population of parents and also young people, the 18 to 29-year-olds in West Virginia, will pay particular attention to this, because that group of people, the 18 to 29-year-olds, is really the group responsible for this rapid spread that we're seeing around the country. But also, I think it's really important to recognize that we also need to protect our children, because even though they may be a little bit less susceptible, particularly really young, children can still get infected with COVID-19 and can get sick with COVID-19. So West Virginia, keep it up. Keep wearing your mask. Keep social distancing, physical distancing. Wash your hands. Be smart. We're doing well, but we certainly have lots of issues that we still need to deal with as we continue to try to open West Virginia, and particularly our schools, in a safe and manner where we can keep them open for a long period of time. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. As the governor mentioned, we do have an outbreak in Mercer County in a long-term care facility. We've had some additional questions about that this morning, so let me provide a little bit more information for you. There are 102 patients and 188 staff. 276 individuals were tested late last week. All but 54 of those test results are in. 54 tests are still pending. We hope to have those this afternoon. We have a total of 31 active cases in this outbreak, 12 patients and 19 staff. We are working closely with the Mercer County Health Department on this outbreak. They contacted us this morning and asked for assistance relative to data entry. We're trying to help keep the system up to date with regard to closing cases, as well as investigations and contact tracing of the current outbreak. Want to thank the Guard again, as usual. They stepped up and they are preparing to assist with additional testing and PPE in Mercer County. So I believe we have a call scheduled this afternoon with the Mercer County Health Department. So we're trying to work closely with them to make sure we contain this outbreak. So, thank you.
All right, thank you, Secretary. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. We're also providing support to DHHR and Bureau of Public Health with testing at Bateman Hospital, preparing this week for additional testing lanes to occur later in the week, working with our partners at the State Board of Education and Higher Education Policy Commission and Bureau of Public Health on school plans, a number of sanitization missions going on this week. Also want to point out that VOAD, Volunteer Organizations Active in Disasters, which helps coordinate all of our volunteer organizations, has established a new case management program specifically for COVID-19 resources and those needing assistance related to COVID-19. This is also partnered with the United Way and the 211 number that you've heard the governor talk about before. So if you have a question, You can call 211. Someone will direct you to assistance. Last thing I'd leave you with, just to remember those who've sacrificed so much on behalf of our nation. On this day in 2004 in Iraq, the West Virginia National Guard lost Sergeant DeForest Talbot to combat operations in Iraq. D. Talbot, for those of you who remember the movie Remember the Titans, was a graduate of T.C. Williams High School and the single season leading rusher in football for that high school, a storied football program, came to West Virginia State University, joined the National Guard to serve his nation, and sacrificed his life in Iraq on behalf of all of the citizens of the United States. We send our thoughts and prayers out to Dee's family on the anniversary of his passing. Thank you.
Thank you, General. Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I'd like to again ask about absentee voting. It sounds like the Secretary of State's office is leaning towards allowing anyone who has fears about the virus to use that as an applicable excuse, but we're not going to be mailing them out to everyone. Can you tell us when we're going to have a definitive decision on that? Thank you.
Well, Charles, first and foremost, that's the Secretary of State's call, and you know, and I'm sure I'll be briefed, and everybody is still, without any question, concerned and worried about this terrible virus and this terrible potential killer. You know, I would say that the Secretary of State will come out with more guidelines. He'll surely, you know, have discussions with our Attorney General, myself, and you know, I think where we're going, I don't know for sure yet, but I think where we're going is you know, if someone does have, you know, a COVID situation and everything that they're genuinely very concerned about and is a legitimate reason and everything, then I think, like I said, I want as many people to vote as we possibly can have vote. I always want that and everything, but at the same time, I don't want us to get in a situation to where, you know, we're just making a situation for corruption, you know, and just teeing it up. But you know, with all that being said, I am a total supporter of everybody getting to vote and everybody figuring out a way for everybody to vote.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, Governor. Just today, we've seen outbreaks in Major League Baseball with the Miami professional team of up to 13 players and coaches who have tested positive for COVID-19 after a 3-game series in Philadelphia. Now, this is the major leagues where they're taking all kinds of precautions. Same with the NBA, same with the NFL, et cetera. You're talking about sports in West Virginia, and I know that that's still on the table. How will the final decision be made? Is it using a formula of acceptable risk versus the stakes which are on the table? You know, the desire to want to play, the desire to give children an activity, the desire to do it safely. Since there is no possible way to have a zero risk formula, what is the acceptable risk? And when do you think you'll be pulling the trigger on that decision ultimately? Thank you.
Well, Kenny, you outlined it probably perfectly. Until we have a vaccine in our hands, there is risk and there's concern. And from my standpoint, if the risks are anything close to significant, I can't go there. I just can't go. And so what I mean by that is now we're in a position of buying time, aren't we? You know, we're in a position that we're trying to get everyone teed up to be able to go. With the September 8th opening of our schools, you know, our K through 12, and the opening of our colleges and everything even sooner. And we're buying time, aren't we? And we're watching. We're watching everywhere we can watch. We're absolutely getting every safeguard in place that we can possibly get in place to be able to continue on with part of our life. This is not just like, well, let's just find something for the kids to do on Friday evening. You know, really and truly, this is important to our communities and everything. This is important to us. And in trying as hard as we possibly can to get back as close to normal as we can and manage this terrible disease, that's what we're trying to do. Now, it's tough. It's plain tough and everything. But at the end of the day, I've promised you, and I'll promise you to God above, without any question whatsoever, I will not be pressured. I will not be pushed any way. I will listen to all the experts, and I will do the thing that I feel like is the safest and the best thing for all. But we know we just can't huddle up in a house and wither away. We know we can't do that. And so at the end of the day, we're going to have to manage this situation. And we're going to do that with the efforts of all of our medical teams. We're going to do that with the efforts of the federal government. Just think, right now, I think the states are going to be sent an additional $125 billion through the federal government that's going to do one thing, and that is to ensure the safety of our kids and the teachers and the service personnel and our sports programs and everything else to the very best that our nation can possibly do. So, we manage the risk. We go on. There is no other choice. There is no other choice. If we all batten down the hatches and go to our homes and stay right there, we're going to awaken to the awfulest depression this country's ever seen. We're going to awaken to starvation. We're going to awaken to neighbor against neighbor and situations that would be catastrophic beyond belief. And I'm only exaggerating to make my point. So what do we do? What do we do? If we're not going to do that, what do? We manage the risk as best we possibly can, and we're doing that.
All right, thank you, Kenny. Next, we'll go to David Beard with the Dominion Post.
Hi, I have a couple questions that were brought to me by some people who attended free testing here in Mon County. They had to wait about 10 to 11 days for their results, and we know that the demand on the labs can affect the timing of the results, so that's not really the issue they raised. One issue they raised was given that length of time, they weren't told to self-quarantine while they were waiting for the results, and they're wondering why they weren't told that. And the second part is, since they weren't told to self-quarantine, they had to wait so long, they're wondering what good was the test, because if they were out and about, they could have picked up the virus while they were waiting, even if they were negative the day they got tested. Thanks.
David, this is Jim. Thanks for the question and everything. I think Secretary Crouch, you could start. Maybe some of our health experts can weigh in, Dr. Amjad, or whomever, but you guys can answer this a lot better than I.
Yes, sir, Governor. Thank you. We're very concerned about the delay in getting results from our testing labs. National labs, some of the national labs are looking at 7 to 14 days. Even local labs are looking at 7 days right now. So we're working with them. We're trying to make sure we get caught up. Sometimes a delay of 7 days, 10 days really makes it almost useless to do the test. We have to get quick results to be able to do contact tracing. The question regarding individuals being asked to quarantine, if they're going through a drive-through and they're asymptomatic, they probably would not be asked to quarantine. And I'll let our health folks or our medical folks opine on that. But clearly, if someone has symptoms, they should be self-quarantining. They should be isolating and should be trying to make sure that they aren't responsible for spreading the virus further. So with that, Clay or Ein, would you like to jump in?
Why don't you go ahead, On?
Okay. David, I'll answer that first. And the delay in testing is an issue. But if you have symptoms, you definitely need to quarantine until your test results come back. It's very difficult if you have to wait. We understand that. Sometimes employers have issues with quarantining for 10 days, and that has become an issue. However, if you're asymptomatic, some people who go through testing may have an issue with self-quarantine. I do know that anyone who goes for a COVID test has been asked to self-quarantine before the results come back. It may be a miscommunication issue from the testing sites, but I know that we have been asking patients. In fact, we came out with a letter recently to give to people, asking them to self-quarantine until your results come back because of the same issue that you just brought up, David. So may have been a miscommunication, but if you have symptoms, you need to self-quarantine until your results are back. But I'll let Clay answer it.
No, I think you guys covered it.
Let me mention, this is Bill Crouch. Let me mention one other thing so everyone is aware. We're working hard to try to develop more testing capacity at the state level. We're looking at the state lab and trying to develop, acquire additional equipment and looking at staffing and trying to expand our testing in-house. In addition, WVU is developing testing resources out there. So we really would like to be self-sufficient as much as possible from that standpoint so that we don't rely on national labs who are backed up from testing for other states. So we will give you more information as we move along on that issue, but we are looking at trying to develop more testing in the state of West Virginia that we can depend upon.
Hey, just 1 second. Let me just follow up, with what our secretary and Dr. Amjad's already said, and I'm sure Dr. Marsh would echo the same thing. And that's just this. First of all, there's a real live effort that's been in place, and it continues to go on, that West Virginia will become self-sufficient. And absolutely, that we've got dollars that are working right now with WVU to have an additional testing source that we don't have right now, that we feel like, and we're very hopeful that that's going to be up and going toward the end of August and everything. But now let's just be fair again. And I want to just tell you just this. This situation nationwide is a problem. It's a problem. That's just all there is to it. And a lot of our national labs are being pushed flat to the limit because you're getting so much of a surge that is happening, especially in the southern states and wherever it may be, that it is taking capacity away from all kinds of different places. Now, with that being said, as we go forward, West Virginia, we want to be totally self-sufficient. We have put real dollars in trying to assure that we'll have adequate PPE. Our National Guard is working phenomenally well with that and everything, and we're in pretty dadgum good shape there. You don't see us screaming and crying and everything about PPE today. You don't see situations to where people are sitting, and as they are in other states, people are sitting in cars for 10 and 11 hours to just get tested. And then the results are just what we said. They're lagging. They're 7 days or 10 days or whatever it may be. We all know the fact that if you don't get a report back within 10 days, it's almost like, well, why do the report? And look at the damage that we would have caused during the 10 days, And so we get it, and West Virginians, you're doing pretty dadgum good, and we're very, very thankful to all those that are helping in every way. And I'm sure they're not going to go through and name and all that and everything because I'll leave people out. But West Virginians, you're doing pretty good. In fact, you're doing a whole heck of a lot better than most people are doing. But at the same time, it is concerning nationwide. And you got a lot of people that are pouring a lot of juice into this to try to solve that riddle too.
All right, thank you, David. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Hope everyone's having a good day. I've been trying to get a reference point on the kids going back to school, and I revisited my days in school. And Governor, you're only a little bit older than I am, so you probably remember the days of the measles. And I'd like to hear from the medical panel if there is a common point there that we can kind of draw some conclusion with how measles spreads, how fatal they can be, and COVID-19 as we get parents ready to send kids back to the classroom potentially on September 8th.
Well, Paul, before I pass it on, and I'll pass it in just 1 second and everything, I want to say just this. Thanks a lot, Paul, for mentioning that I'm older than you. I mean, that really made me feel a lot better. Thanks a bunch. But anyway, if our medical team could pick it up, I appreciate it. And I'm just teasing, Paul.
Maybe I'll start this one, Ian, if that's okay. So the reproductive rate of measles is much higher than COVID-19. I think the reproductive rate of measles, and I'll have to be checked on this, but is in the neighborhood of 5 or so. The reproductive rate of COVID-19 is thought to be about 2 to 2.5. Again, remember the reproductive rate, or the R naught, is the number of people a single person with the disease would likely be able to infect. You know, as we look at measles, that was a real significant problem. We understand the benefit of having a vaccine that has been deployed, because measles has been under relatively good control from a public health standpoint, with the exception of a few outbreaks in areas that children were not consistently vaccinated. And remember, West Virginia has one of the best records across the entire country for vaccination because of the requirements to have that for school. And so as we look at COVID-19 and look at the reproduction rate of COVID-19, say, versus the flu, which will be coming up, the reproductive rate of the flu is about 1.2 to 1.5, which means a single person with flu spreads to about another person or a little bit over, whereas a single person infected with COVID-19 spreads to 2.5 people. So COVID-19 is a much more infectious process. And in fact, the addition of the fact that people that are not symptomatic yet, or are pre-symptomatic, or who remain asymptomatic, are the ones who at least half the time, maybe more than that, are the ones who are spreading the disease. So the transmissibility of COVID-19 is much greater. And we've talked before about the severity of COVID-19 seems to be more severe in older people. But as we talked about today, there is a % of younger people who will be hospitalized, and people who can get very sick and can have long-term side effects of COVID-19. And if you look across the world, about a 4% mortality rate right now, about a 3.3% average mortality rate from COVID-19 in the US. And we've talked about if everything else was corrected, would it be lower if we were able to define everybody who has COVID-19? And the answer is yes, probably. The mortality rate for influenza is much lower, probably between 2 to 5 on the low side, to maybe 10 to 20 on the high side, more lethal COVID-19 versus influenza. So hopefully that answered part of your question.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and staff. Governor Justice, of course, Congress is meeting again this week to flesh out another federal aid package. I'm wondering what specifically you may have requested from our congressional delegation in terms of what we need. And we're already hearing that the Republican proposal will only have $200 in federal unemployment supplements versus the $600 that folks are getting now. And I'm just wondering what you think that is going to have in terms of an economic impact on West Virginia.
Well, Mark, there's no point in going through all the different requests and everything. We're making requests to lots and lots of different folks, you know, from all the way down through the White House, through all of our congressional teams, through all of our office and everything. But here's what I think is going to happen. I think from the standpoint that the Republicans, the initial push was to do like 70% or so of the unemployment benefit level. Basically from the standpoint, or the unemployment, the benefit level. Okay, so anyway, if you could just look at the procedure or policy, I think what's coming from the standpoint of the Republicans they're saying, we know that people are hurting, but we want to encourage people to get back to work. And we all have got to realize when people were getting $600 a week, which I loved it teetotally to death, because those multiplier dollars could go right into our economy. But when people were getting $600 a week plus their unemployment benefits. Before you know it, a lot of people were discouraged to go back to work. Well, we need our people at work, and we had unemployment levels of 15% or whatever it may be across this country, and a lot of businesses couldn't get people to work, couldn't find people to do work. And so now, does that mean that we want you to go back to work in an unsafe atmosphere? Of course not. I mean, that doesn't mean that at all. It's just common sense. We need our people within our country to be back at work, because if they're back at work, they feel a very much stronger feeling of goodness from themselves. They're delivering incredibly for our country and all of our people. All that's great. Now, what I think you're going to see is, I think you're going to see a little bit less of a contribution towards helping those that are still unemployed. I think you're going to see the ability for our businesses that have still really struggled and maybe stayed at a level less than 50% of what their business was, that they will be able to maybe possibly apply for some additional PPP. Now, I do not write the legislation, and all I'm giving you is my best ideas, my best thoughts. I think you'll see that there'll be real money set aside to be able to assure, on top of assure, the safety of our kids and teachers and service personnel and everything going back to school. I really believe that you'll see some level of assistance to the states. And I also see, and I think without any question, you will see what I have been preaching from day one. Ultimately, we will be able to backfill revenue. Now, we've not been able to do that, but ultimately, on dollars we have received, we will be able to backfill revenue. They won't call it that maybe, but that's what we'll be able to do. So, Mark, that's what I think is going to happen.
All right, thank you, Mark. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. My newspaper's been getting a couple complaints from some people involving the DMV offices. Obviously, appointments have to be made at the DMV offices due to the COVID crisis and all that. But they're saying it's taking a long time to get through by phone. I'm hearing of lengthy times, for example, several weeks, to get an appointment with the DMV. I was curious if any of these complaints were rising up to the governor's office, if you've been hearing any of this, and if there's any help that you all or the National Guard can give to the DMV to help if there is a substantial backlog there. Thank you.
Stephen, they have come to my attention. I think those people that have contacted your papers have a very legitimate situation. They have come to my attention from the standpoint of where I am is just this: we have extended all the licensing, issues, and we're working through getting it to where the ease of people getting in and out and giving them the proper attention. We're working through that. That has been a problem. I think that it's a legitimate complaint that we're working on.
All right, thank you, Steve. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. My question is about the next stimulus package. Obviously, the lawmakers were working on calling themselves back into a special session. That hasn't happened because of leadership in the Senate. But I'm curious if you have any plans to involve them more closely in this next stimulus, and if these meetings could be made public, if you plan on working with them in any particular capacity like that.
I think this is an easy answer for me. I think just this, we formed the advisory committee. Okay, the advisory committee, we informed them of what I thought is the way that where the CARES money, how we ought to be handling the CARES money. The original CARES money of the $1.25 billion. Now, keep in mind that in that we set aside $678 million of those dollars to make sure that we wouldn't get in a situation where we would have to lay a tax burden on our small businesses and on our businesses across this state. Now that money's sitting there in a bucket to ensure that we'll be able to backfill the dollars that we've sent out and drained our unemployment fund to Zippo and all that kind of stuff. Now, with that being said, there's real chances that situation, basically what we did is we took a loan against that and everything, and that the loan will be forgiven. If that be the case, or a portion of forgiven, that's going to free up dollars right there that I have told our legislature in every way. I have exhausted what I think is the legitimate ways that we can send out monies. And so I am asking them for their guidance and their help if that happens. But to more directly answer your question, we do know that there's a possibility of more dollars coming into our state with this fourth stimulus package. And if that happens, there may very well be a need to bring everybody together in a special session and say, okay, I have taken it from a standpoint of a basic care situation to a point now from watching the economics and getting us through the last year, and now forecasting where we're going to go in this year from the standpoint of moving that income tax filing to July 15th and jump starting July. And you will see very, very soon when we come out with our August report on our July numbers, you're going to see exactly what we did and how we did it and how we just started the year off in a great, great situation. Now, with that being said, we have three different areas, and I want to be absolutely certain that we understand this. We've got $678 million that's sitting there to protect us from the standpoint of raising taxes on unemployment. We do not want to do that, and we will not do that in the state of West Virginia. We will not increase taxes, period, because we have that safeguard. Now, if the federal government forgives that safeguard, that's monies we can spend on all kinds of different COVID-related things within the state. We can backfill revenue. We can do all kinds of stuff with it. That's one. The second thing is just this, is we have $1 billion, and I underline $1,147 million in grants. And we need everybody in our state, especially our legislatures, working on that and digging into that in every way to make sure we don't leave money on the table that we can use in this state for our people. That's the second bucket. The third bucket is this: if we in fact get additional monies into the state of West Virginia beyond the monies that we already have from a standpoint of additional CARES money or whatever like that, or we get or the other things happen, forgiveness of the unemployment or whatever like that, we absolutely need to continue to involve our legislature, whether it be in the task force that we have formed and the leaders are soliciting information. You got all kinds of reasons not to come in. From the standpoint of if we come in, we're going to bring lots and lots and lots of people here and all that kind of stuff. We already had a semi-little outbreak on the House side of COVID. That's an issue. There's absolutely the issue that we'll get 7,000 ideas and all we'll do is spin around and spend the taxpayers' dollars for something that we can do the way we've got it set up in an advisory force, to where the leadership participates on the calls and the leadership solicits information from the House members, the Senate members and everything, and then we continue to pump that information into the process and continue to make everything work. But I can't be more transparent than that. Those are the three big things on the table today, and there's surely additional opportunities for West Virginia.
All right, thank you, Dave. Governor, I'll turn it back to you.
Well, I'll be really quick in ending because you've heard enough from me today. I would tell you that I go back to the same thing, wear your mask. You know, when we came out and we said we're going to make it mandatory, you know, I'd been preaching forever, wear a mask, wear a mask, wear a mask. Dr. Marsh, wear a mask, wear a mask. On and on and on. And then we got to the point in time where I felt like if we don't do something to move right now, we're going to be in a situation, and the experts were telling me exactly that. And so we made it mandatory. And you know, if you go to Walmart or Lowe's or, you know, Home Depot, wherever you may go, you're going to see people complying in a great way, a great way. I think our churches, I think everybody gets it, that really and truly, that right there is maybe the last bullet in the gun, that we can absolutely stop this thing. This is our power. Now, I hear over and over and over and over and over that young people or whomever, if you get this and everything, you get well, and you get well in a matter of time and everything. We even heard the absurdity, you know, that really that almost no people die from this and everything else. Well, there's a lot of people that die. There's 146,000 in our country now and growing every day. Absolutely. In West Virginia now we've lost 106, and that's terrible too. But the biggest thing I want to forewarn you about in West Virginians as your governor is just this. You know, there's real live side effects to this. And you may get this and you may very well get over it. But it may very well cause you catastrophic issues throughout your life, whether you be young or old. And so absolutely do not take this lightly. Please don't take it lightly. You know, we're buying some time about going back to school. We're buying time to see just what happens. And we're absolutely knowing that we may very well have to pivot and go differently than what we all hope. We all hope like crazy we're going to be able to go back to school and everything's going to be okay. Everybody is absolutely hopeful of that in every way. I'm telling you, from your governor's standpoint, we're buying time right now. We're buying time to make sure as we can be. And the last thing I'll say is just this. You know, General Hoyer, from time to time, brings us to a history lesson on the greatness of our military and all the incredible things that have happened. He talked about a great person that we lost in a military situation not long ago. A person that was a football star at his high school in the state of West Virginia. A person that was a football star that decided that he was going to serve our country. We don't want him to be a number, do we? We want him to be in our hearts and in our prayers. Absolutely. Please remember all the greatness that our National Guard and our military is doing all the time. If you can afford it and you'd happen to be in a restaurant and you'd see a couple of young guys or young ladies that represent our country there, take the time to at least go over and thank them. And if you can afford it, take the time to go over and pick up their tab. They are absolutely the ones that we owe everything to. Remember them. It's really important. God bless them and God bless all y'all. Thank you.